Lucas is going to be 20 on July 31st. Like I said, he does have Sanfilippo syndrome. The syndrome has progressed to the point where he is completely immobile at this point. He is completely wheelchair bound and requires all of his day cares to be given to him by someone else, either us or nursing. He has to have a G-tube to get all of his nutrition and all of his supplements and medications. He has problems with some of his secretions, so we have to manage that throughout the day through suctioning and through medications. He also has asthma, allergies. All of these things are attributed to the progressiveness of this disorder. He's also at the point where he's also losing core strength, so even sitting up on his own is becoming difficult. At night, we have to continuously reposition him and check on him and his secretions, and mainly the repositioning so that he does not develop any type of bed sores. We also have issues with seizures and dystonia, very painful for him to go through. So we try to stay on top of that, keeping things stabilized, keeping track of his blood work, watching his symptoms throughout to try to make sure that he's comfortable. Because he can usually, even though he's nonverbal, he seems like he knows when something is going to take place, either seizure or dystonia, and he kind of verbalizes us that something is about to happen. And at that point, we start making changes. Either we're going to give him either Valium or we're going to give him Tylenol. We're going to reposition him in hopes that we can keep him comfortable. Lucas was not diagnosed until age 8, and our journey started with he was losing skills. He for a long time would put his shoes on by himself, and he was talking in 2 to 3 word sentences, and he started losing those things. He was also falling a lot. We first had to get a referral from our pediatrician to see specialists to try to figure out what was going on. And their initial diagnosis when he was 3 was that he had regressive autism as well as a moderate hearing loss. So at that point, we thought we were treating him for autistic symptoms. So we started doing therapies and researching things that would help children in the autistic community. So we followed that through for quite a few years and also did hearing aids. Now, as the years went by, it just still didn't seem like that diagnosis was correct to us. Some of the things that he was doing just seemed a little bit more than what I was researching that the children in the autistic community were doing. He started forgetting things like how to feed himself and holding a fork. And then we started having to remind him things over and over. It was kind of like dealing with a 4-year-old with Alzheimer's. So we kept on that journey for years. And then when he was 8, he was having some issues with his bowels. He was having constipation constantly, and he was in a lot of pain. So we started seeing a gastroenterologist. First time we've ever gone to a gastroenterologist. And we were explaining to her not only the things that were going on with his GI system, but other things that we'd been going throughout the years in regards to losing skills and forgetting things and losing his words. And what's interesting, she as a gastroenterologist remembered all of the symptoms that we were describing from something that she'd studied when she was in grad school, medical school. And at that point, she actually started us on the quest, thinking that it was in the MPS realm. To hold on to hope and to remember that although they're losing skills, they're still there. Continue to push them, continue to thrive, continue, if something's not working, be it for communication, be it for school, be it for just your everyday life, to try something different, because what worked yesterday may not work today. Just remember what it would feel for us if one day we no longer could communicate with those around us. One day we started forgetting things that were very important to us the day before, and realize that some of those signs and symptoms are just our kids crying out saying, I'm still here and I just need you to be here with me as well. Also, it's going to be a long haul in regards to therapists and specialists. Keep strong. Make sure you are following through with whatever you believe is wrong with your child. Do not let them tell you a different. Push them to listen to you and do what you need for your child.